To apply the sugar tongue, you'll first need to determine the correct splint width. Measure the patient's wrist with a measuring tape or a ProCare elastic bandage. A 1/4 inch to 1/2 inch extending over each side of the wrist indicates the correct splint width. To make sure the edges do not overlap on the ulnar side as the splint forms, it's recommended that you reduce. Before you apply the Exos Rapid Splint Sugar Tongue, it's necessary to heat the splint. First, make sure the splint warmer is completely closed. Then, take the Exos Rapid Splint from its package and remove the foam padding if applicable. Slide the splint, folded end first, into the open end of the splint warmer. Leave about 2 inches of the splint exposed. Attach the hook wand to the exposed end of the splint, then slide the splint all the way into the splint warmer. To begin heating the splint, plug in the splint warmer. Allow the splint to heat for about 7 to 10 minutes. To confirm the accurate length of the Exos Rapid Splint, use a measuring tape, ProCare elastic bandage, or Exos Rapid Splint and measure from the patient's palmar crease down around the elbow, back up to the dorsal MPs or knuckles. After the Exos Rapid Splint is heated, remove the splint from the warmer. Please note, adjustments can be made to the splint prior to heating or post-heating if necessary. Trimmed edges should be rounded. Reapply the foam padding if applicable, and ensure padding extends beyond the edges of the splint. Trim the pad if needed. Ask the patient to hold the splint in place while you apply the ProCare elastic bandage. Begin by securing the splint with 2 wraps around the wrist. Continue by wrapping twice around the hand. Then progress proximally down the arm to secure the entire splint. And finish by wrapping around the elbow. Be careful to avoid putting pressure on the ulnar nerve. Typical positioning is with the patient's elbow at 90 degrees of flexion and the wrist positioned at neutral. Use moderate elastic bandage tension, more than you would with fiberglass or plaster splints, to ensure good molding. Add shape and contour to the Exos Rapid Splint by molding with your palms. This significantly increases the final strength and rigidity of the splint and reduces setup time. If the final position of the splint is not ideal, remove the elastic bandage, place the Exos Rapid Splint back into the warmer, and repeat the application process. With standard heating time, overall hands-off rigidity should be achieved in approximately 3 to 5 minutes, while full rigidity will be achieved in about 10 to 15 minutes.